Welcome to the aCough educational tool, designed to teach you how to reduce the risk of breathing complications after surgery. By the end of this video, you'll be able to understand why a lung infection is a possible complication after surgery, recognise the aCough acronym and describe what each letter stands for, and apply the active cycle of deep breathing, or ACBT exercises, to your own preparation for surgery and recovery. So let's begin with number 1. Let's understand why lung infection is a possible complication after surgery.
Various surgical and anaesthetic factors can lead to lung collapse, reduced lung volumes, impaired clearance of mucus, and a weakened cough after your operation. These factors can contribute to bacterial growth and lung infection. This risk of lung infection is higher if you have pre-existing lung disease, smoke cigarettes, are having abdominal or thoracic surgery, or are having a lung operation. The good news is there are things that you can do to reduce your risk. There are some important steps that you can take in the lead up to your surgery. These include getting active and doing exercise, eating a healthy diet, stopping smoking as soon as possible, and brushing your teeth twice per day and seeing your dentist for a checkup. All of these measures improve your lung health before having an operation. In fact, preparing your breathing muscles for surgery may be just as important as exercise is for the rest of your body to improve your overall fitness before surgery. Research has shown that you can decrease the chance of post-operative pneumonia up to 50% by training your breathing muscles before and after surgery. This is important because pneumonia, or an infection of your lungs, can prolong your stay in hospital, affecting you, your family, or carer.
So this leads us to point number 2. Recognising the aCough acronym and describing what each letter stands for. So what is aCough? aCough is a tool that we can use to help us remember the steps taken to optimise lung health and reduce the risk of complications like pneumonia. Here's what aCough stands for. A stands for the active cycle of breathing technique, or ACBT. Research has shown that you can decrease the chance of a pneumonia by up to 50% by performing these breathing exercises before and after surgery. We will teach you these breathing exercises in a moment. C stands for coughing. Start your breathing exercises and coughing as soon as you wake up from surgery. You'll be reminded to repeat these exercises every day at regular intervals. When you perform a cough, use a towel or a pillow gently pressed across your wound to help reduce the discomfort. O stands for oral health. Brush your teeth twice per day with fluoride toothpaste and gargle with mouthwash twice per day. This helps to control dental plaque and reduce the amount of bacteria in the mouth that could contribute to lung infection. And U stands for understanding. This is your surgery, and it is important that you, your family, and your carers all understand the actions that you can take to improve your chance of a successful recovery. If you have any questions, please ask a member of your team for help. And G stands for get out of bed. As soon as possible, we want you to get out of bed, sit in a chair, and commence a walking program. Being upright is the best position to expand your lungs again after surgery. Sitting upright and walking can happen on the same day of your surgery if it is safe to do so. A physiotherapist or a nurse will be there to assist you until you can do it yourself. When you're able to eat food after your operation, take your meals sitting in a chair rather than resting in bed. You should walk around the ward multiple times every day and gradually increase your level of activity as you heal so that you become stronger every day. Pain relief will be prescribed to you to help you with this goal. But getting moving will not only help your breathing, but it'll also improve your pain management, blood circulation, muscle strength, gut function, and mental health. H stands for head of bed elevation. Try not to lie flat in bed after surgery unless you've been told to do so. When you are in bed, sit upright or keep the head of your bed elevated at approximately 30 to 45 degrees. This will help to keep your lungs expanded and reduce your risk of breathing complications.
Now that you understand what aCough stands for, it's time to explain the active cycle of breathing technique, or ACBT exercises to you. Like any exercise, the more you practice, the better you get at it. Do these breathing exercises every day, twice per day before your surgery, and you will strengthen your lung function. After surgery, you should complete these exercises at least once every hour that you're awake. ACBT breathing exercises can be done in 3 easy steps. To start, be as upright as possible, sitting up in a bed or the chair. Number 1, breathing control. Place your hands on your stomach. Take a relaxed breath in through the nose and a relaxed breath out through the mouth. Feel your stomach rise with your breath in and fall away as you breathe out. This is a sign your diaphragm is moving up and down. Continue this for 30 seconds. Breathing control works by increasing your lung volume. Number 2, thoracic expansion. Place your hands on your rib cage. Take your deepest breath in through the nose. You should feel your rib cage expanding and your chest will feel tight and full when you fill your lungs with air. Now hold the breath and count to 3 before exhaling the air completely through your mouth. Repeat this 5 times. Thoracic expansion helps to open up areas of lung collapse. Number 3, forced expiration. This is your huff or cough. This will help to clear mucus from your lungs. Take a deep breath in through the nose. Open your mouth into an O shape and breathe out with a short and sharp huff, as though you are fogging a mirror or glasses. Repeat this 5 times. After this huff, you should perform a supported cough to clear any loosened secretions. These exercises are completed in a cycle of breathing, which should be done every hour after surgery. This cycle is breathing control, followed by 5 thoracic expansions, followed by another period of breathing control, then 5 more thoracic expansions, and finally, forced expiration. That is your huff and supported cough. Now remember to practice this cycle before you come into hospital for your surgery.
Now you should be able to understand why lung infection is a possible complication after surgery. Recognise the aCough acronym and describe what each letter stands for, and apply the active cycle of deep breathing, or ACBT, exercises to your own preparation for surgery and recovery. Remember, your treating team are always here to help. And if you have any questions about the recommended breathing exercises or the steps in the aCough programme, please ask us. We want you to recover from your surgery as quickly and as safely as possible.